This panel is going to be a continuation of the previous conversation. So the way that we set this up was to think about systems for digital inclusion during the last panel, and then we wanted to give some examples of how this work around digital inclusion is actually working on the ground. And so I'm very excited about all the content today, but what's particularly exciting about the group that I have with me is these are individuals working to facilitate organizations at the ground level in communities. So I'm going to ask if we'll start with Joe. Can you give us an overview of the work your organization is doing? Tell us about the community you work in and the programs you're providing.
Okay. Again, my name is Joseph Caesar, Executive Director of the Legacy Institute for Financial Education. We're located in Lufkin, Texas. We started the organization in 2014 in Houston, Texas, to be a financial literacy organization to teach college-age students about money. We recognize that many of them graduated not knowing how to buy a house, how to build their credit, things like that. Over time, I took a ministerial position in Lufkin, Texas. So we moved the organization into Lufkin, which was a completely different dynamic from what we had to deal with in Houston. But our mission is to teach financial literacy, create economic stability, and build generational wealth. And that creation of economic stability is really where this digital divide causes a problem. In Lufkin, Texas, we have a population of about 35,000 people. Many of them are in poverty, low income, and many of them struggle with simple things such as accessing their bank statements or just their bank account using their phone. I'll give you an interesting example. In Houston, if I had a kid with a laptop and we were in a church or a different setting and we didn't have internet, the kid would just take their cell phone and tether their laptop to the cell phone. But in Lufkin, many people didn't know how to do that. So we, in order for us to do our job effectively, we had to teach people digital literacy so that we can help them build budgets, so we can help them build their credit and things like that. And ultimately, we started a program called LifeTech, where we began to train people on how to enter into the IT career sector. We have a fundamental belief that is where the job opportunities are going to be in the future. So in LifeTech, we have people that are able to earn their CompTIA A+, Network Plus, and Security Plus certifications. And we offer some of those services to the community. I will give you one example, and over this discussion, I can give more if needed. But we work with Angelina College, where we were able to access some of their computers that they were going to give away for recycling. We intercepted those machines, we refurbished them with our students, and then we offer them to the community at low cost or no cost. So that's just one example of how all this ties in together.
Great. Diane, do you want to share?
Sure. So I'm Diane Connery, the library director in Pottsboro, Texas. We're 90 miles north of Dallas. I had always lived in large cities, urban areas, and then in 2010 moved to this small community, and the library received no public funding, all donations, all volunteers. The volunteers were aging out, the library was getting ready to close, and I got involved with the library, and each meeting was a discussion of how many months left do we have in the bank account before we have to close. And I would see the kids who would come into the library, and because of where Pottsboro is, many of them do not have broadband access. They don't have devices. The infrastructure just does not exist. And I started wondering how they would ever be competitive when they graduated from high school without that experience. And so we started doing some very non-traditional things. First, we established an organic garden for 100 beds, a library of things where we check out non-traditional items like outdoor games and tables and chairs and tools and all that sort of thing. And then digital inclusion programs. And so we received a grant for an esports program. We became the first esports program in the nation in a public library. And a lot of people think of esports or video games. I picture the, 30-year-old man sitting in the basement yelling upstairs, "Mom, bring me a sandwich," or something. But it is more than that. It's developing critical thinking skills and digital literacy skills, and video games social capital for young people. And so we were able to hire esports coaches and bring these kids in and have them from Pottsboro, Texas. They're then playing games with kids in Japan and talking online through the Discord server with kids all over the world, which was just such a fabulous exposure for them. And then COVID hit, and because Texas is the Wild West, we stayed open throughout the COVID. But because infrastructure doesn't exist and people needed access to the internet in Pottsboro. And so people would come in. Very first, it was, if you remember how uncertain it was, is they needed to fax end-of-life documents to their attorneys and that sort of thing. And they needed to get online to file for benefits. So we would help them with that. Libraries are great at assisting in digital literacy skills. And then we started getting some calls from people who needed to have a medical appointment. One in particular comes to mind. She was a woman who had had an MRI shortly before the shutdown happened, and she has chronic obstructive pulmonary disease. And her neurologist called her and said, "I need to talk to you, but you're too high risk to come into the doctor's office. Can you get to a place where you can access the internet?" And she called the library, and I put her in my office on my laptop and connected her so that she could get the results she needed. We are the public-facing entity in rural communities that really sees the needs front and center every day. We know exactly what the people in the community need. A mother of five who, 5 boys, bless her, from ages 5 to 12, came in, and when the school shut down, she told me that the family has 1 car. The husband takes it to work Monday through Friday. She has 5 sons, 3 of whom have special needs and needed special online education, but she didn't have connectivity, she didn't have devices, and she had gotten her GED 3 years before all of this happened. So we as a library were able to set her up with connectivity and the devices to make that happen. For those kids, that meant the difference of losing a year at least, but probably more than that, of education and thriving in their situation. So we have the privilege of doing that. And I will say 10 years ago, we had no public funding at all. Now our town is, between town and county, we get about $40,000 a year in public funding, which doesn't sound like a lot because that's all in. That's salaries and utilities and computers and books and everything is $40,000. So we are able to do an amazing amount of work, mostly through partnerships and grants. When the shutdown happened, I call him my work husband, my local ISP. I could not do what I do without him at TechWave. So we got a small grant to set up neighborhood access stations. So permanent hotspots in areas where people don't have transportation and don't have connectivity. It was a tackle shop. It was a volunteer fire department, a convenience store. So we don't have, not only do we not have public transportation, they've never heard of Lyft or Uber, of any of that. So if they don't have a car, they have to walk to connect. And obviously that's not ideal in Texas. And so we recognized that the longer term solution would be something that they could access in their homes. And so through a Texas State Library grant, we got funding to create internet in people's homes, 40 low-income students' homes. And so internet service provider created these 40 client boxes. They can come to the library, check them out, and take them home. If they live within a mile of the library, they now have internet in their home, which is much better than sitting out in a parking lot to do that. So we have a tower, 35-foot tower in the back of our library, and we're continually working for longer-term solutions. Those of you who are familiar with Emergency Connectivity Fund, $7.17 billion, I always choke on that number, $1 billion just for libraries and schools. And again, due to the limited capacity our small library has, I had to work with partners to get those funding requests written and submitted. And so, fingers crossed, what we've submitted is a $7.5 million request to put up towers around libraries in our county and throughout our town. So digital inclusion, thank you. Fingers crossed. So digital inclusion is really our niche. We're not so much about books. We're not the traditional library you remember from when you were in 4th grade. We're an essential service to our community.
Thanks, Diane. So you've been doing infrastructure, access, esports, telehealth, all the things for your community of 2,500. Joe's came at it through a financial literacy and workforce perspective. I'm going to ask Gabby, who's worked with Operation Connectivity, to share her perspective.
Thank you. Gabby Rowe, the managing principal of Grow Associates, but most importantly, the project lead for Operation Connectivity, which is, for those of you who might not know, the statewide effort across Texas to ensure that all 5.5 million public school students have a connected device and the connectivity for that connected device at home. And every time I've said that 1,000 times, and I think about that daunting task of connecting 5.5 million students. But the one thing I've learned in that is that there is a student in every square mile of this entire state, which means that what we're really doing is figuring out how to connect the state of Texas, which has been an amazing journey. We started by first looking at devices right during the height of COVID, and discovered that procurement was probably the single most difficult challenge. And working through OEMs and working through a bulk purchase across the state, we were able to put 4.5 million devices into the hands of the most unserved and neediest students across the state of Texas. Of the 1,228 districts in the state, 976 of them participated in that program. So we really were able to reach every county in the state. But what we discovered very quickly was that we could put a device in a child's hand at home, but if they couldn't connect to the internet, it was only so good for them. And so our students still had to go sit in school parking lots, in library parking lots, because most of them were still closed. And it really didn't solve the problem that we had been tasked to solve. So we began the process of assessing what was behind that problem and collecting the data necessary to map to that, with a lot of help from wonderful participants like Connected Nation, like the rural funders. And that allowed us then to support the communities, what we call the 828 most disconnected census block groups in the state of Texas. And we are supporting 9 different geographic areas that are looking to launch pilots and apply for funding for those pilots. They are Amarillo, Lubbock, Abilene, El Paso, I'm never going to remember the full list, Lufkin, McAllen, and they really do cover Brownsville. They really do cover the areas that have the largest populations of disconnected, dense disconnected groups of households. Knowing, of course, that as you move further and further out from urban centers, even from towns, the distances between those households become further and further. So we really needed to think about innovative technology solutions to make sure that the students who lived in those communities could do synchronous and asynchronous learning, which meant that we weren't just looking at completely unserved, we were also looking at unserved. And it's been a journey from which we've learned a couple of really important facts. The first is, if it was easy, it would have been done already. And anybody who tells you, well, we were just waiting for the right moment, I think we had somebody reference snake oil before a little while ago. But The other is that there is no one group that's going to be able to solve this problem by themselves. The collaboration is going to be the single key across all of our communities to making this a reality for all of our communities. And when I say collaboration, I mean collaboration from a governmental standpoint, federal down to state, down to local, but also making sure that everybody in the community has a seat at the table. The NGOs, the hospitals, the libraries, the educational providers, the workforce development providers, housing developers, they all have to come together in order to work toward the same end, or we simply won't get there.
And that's a great segue to thinking about some of the challenges and solutions that have been developed. So you've seen this work unfold in a number of communities. Gabby, I'll start with you, and then we'll go to Diane.
I think that there are some challenges which I named already, getting everybody to sit around the table. I think that fortunately the pandemic solved some of that for us. I'm a lifelong educator, third generation educator. I know I've been talking about connectivity in my world for at least the last 25 years. But the pandemic helped us, that silver lining in a really bad situation of getting everyone to want to sit at that table to solve the problem. For me, the problem, though, that keeps me awake at night now, the challenge that keeps me awake at night, we referenced in the last panel, which is adoption and utilization. And that is going to be a long journey that we all have to engage in and participate in. And it means building up those digital literacy skills. It also means removing fear and the trepidation that many families have about what the potential negative impacts of the internet could be. I mean, we speak a lot, those of us who are in this world doing this, we speak a lot about how we're going to transform our economy, how we're going to transform families through the use of the internet. There are many, many people who don't understand that and who are actually fearful of that. And that's a real wedge that we've experienced, particularly on the education side, where families just don't feel comfortable bringing that service into their home for a variety of reasons. And so we have to make sure that all of us together work on coming up with trusted solutions. That means your faith-based groups and your NGOs, your schools, really trusted members of community have to work with us on adoption and utilization.
And I think Terry asked a great question earlier, to the library and United Ways. There's a lot of organizations addressing it. Diane, do you want to talk about some of your challenges and ways you all have been addressing them?
Yes, and I will say I have more challenges than I have solutions for. So I will say probably our biggest challenge as a rural library is capacity. We're understaffed, we're under-resourced, and we have the desire, though, and so what that means is we have to do this through partnerships. And one example, I mentioned the person who came in for the appointment with the neurologist. That became a more obvious need in our community, that people needed telehealth. And come to find out, people in rural communities have worse health outcomes than those in urban areas. And some of that may be transportation. It takes too long to get to the doctor, but some of it has actually been identified as digital inclusion in and of itself. Digital inclusion is a social determinant of health. So if our communities want to be healthy, we've got to be included. So I could understand the library side of telemedicine, that, we've got this old room full of dusty books that people donate that nobody ever wants. So if I clear that out, I can make a telehealth room in my library. But I couldn't understand the other half of that equation, what the healthcare providers could inform me about and make this a formula that would work for our community. I fly by the seat of my pants. One of the lovely things about being in a rural community is if I have an idea in the morning, I can implement it that afternoon. There's no bureaucracy. It's just lovely, lovely freedom. Turns out hospitals do not operate that way. And so I started talking to the University of North Texas Health Science Center in Fort Worth and how would we make this work? And so after months and months of Zoom calls with their disinfection team and their marketing team and all of the various different teams, and not the least of which is the National Library of Medicine gave us $20,000 to launch the telehealth room. So what we did in our case, and I believe we were the first public library in the country to have a telehealth room, which Pottsboro, Texas, that always blows my mind. And so the way it works in our library is people call the Health Science Center to make an appointment on Tuesdays and Fridays. And then then they do all the paperwork, the payment, it's Medicare, EAPs, Medicaid, private pay, insurance. They handle all of that. As the library, I get an email the evening prior and they say, okay, Diane, tomorrow you've got appointments at 10 and 1. And so the person gets to the library. A library is a neutral place in the community. Nobody knows what people are coming there to be seen for. I don't even know. But I help them into the room and then can help them as much with connecting as they need. That might be sitting through the whole appointment with them. Usually it's, I'll make the connection and leave them alone in the soundproof room. And then if they have questions afterwards, well, he thinks I have gout. What do I need to know about gout? Librarians are information specialists, so we can get on the computer, connect them to Medline Plus, credible resources, and pull up some. I'm not doing surgery, but I can help people get to the resources they need. We have the fastest internet connection in town. We can help with digital literacy skills, and we can connect them with the experts that they need to connect with. So that's 2 days a week, physical health, I guess you would say, and now we've started a partnership with a behavioral health, mental health practice so that people can also come to the library to get that sort of appointment if they need. We do have a pharmacy, family pharmacy. Yeah.
So, Diane, I appreciate how you build on the assets that the library has and then look for partners and contextualize it for what your community needs. I'm going to turn to Joe and ask, how do you contextualize digital literacy in the work that you're doing for your community?
Great question. We were identified in 2019 as a financial opportunity center with LISC, and you met Krista earlier. Our partnership with Rural LISC has assisted us in many ways with contextualization, not only of financial literacy with our clients, but when we were identified as a digital navigator program through their connectivity efforts, we initially went out and thought that we were going to establish a digital literacy program, and it was going to be off to the side, and we were going to go out into the community and say, hey, we have a digital literacy program. Who all wants to learn digital literacy? And as you can all imagine, we didn't have a bunch of people walking through the door. That is not how that worked out. So what we did was we integrated our digital literacy program with our Financial Opportunity Center and some of the workforce development efforts. So now if we have someone who comes to our organization and wants to become a heavy equipment operator, what we do is we first of all show them how they can type up their resume. We show them how to convert it to a PDF file. We show them from a financial opportunity perspective, when you access your bank account, you see that little lock in the corner? That actually means something. And then when you receive an email from your bank, I'll give an example, Southside Bank, make sure that the person who is sending you the email, look at the domain to make sure that it's not a phishing attack. So while we are helping them become a heavy equipment operator, which you may believe has nothing to do with digital literacy, actually has a ton to do with digital literacy, because most of them don't know how to use their phones to send email. They don't know how to access their bank accounts and download statements, which is a requirement for all of our financial opportunity clients. We need copies of their financial statements. We ask them, do you understand what your credit score is and what's on your credit report? No. Have you heard of Credit Karma? Do you know how to download an app? And believe it or not, we partner, you've met one of our partners earlier, Mr. Lonnie Hunt, with DebtCog. DebtCog We interacted with them through a Connect Homes USA grant that they received. They partnered with us. So people who are on who receive housing benefits through HUD, a requirement for their goals and their program is to improve financially and take digital literacy courses. So Vicki Thomas, who used to work for DebtCog, coordinated with us. We ended up handing out computers to these homeowners and helped many of them apply for and receive jobs. So when we contextualize what it is that they're looking for, what are you going to use the internet for? If you're not going to use the internet for a certain thing, then we're not going to teach you that thing. So North Star is one of those, the software packages that we, through our connection with Rural List, that we received, and we were able to enroll people into North Star for a comprehensive digital literacy training program. However, we're teaching people how to use Microsoft Word when they have no business learning Microsoft Word. So we interview our clients to find out what they're looking for. And I'll bring up another example. We had one client that wanted a Wi-Fi hotspot. She said that she didn't have internet in where she lived. So we did some research, found out that there were some providers that were available. But then the entire time she's in my office, she's on her phone. And she's getting text messages, and so I asked her, who is your provider? And she said AT&T. And I said, do you have tethering? And she said, what is that? So then I showed her how to adjust a setting on her phone to where she can receive or turn her phone into a Wi-Fi hotspot. Now, we provide hotspots at a low cost, $240 a year through our partner Mobile Beacon. And that will get you 6 megabits per second. If you're in an LTE area, you get up to 25. And if you're in LTE plus, you get up to 100. Well, rather than have her spend $20 a month, I showed her how to use her phone, and she didn't have to pay anything. So those types of questions, what are you going to use it for? What do you have at your disposal? That's all a part of digital literacy. So that's how we did it.
That's great. Do you want to add anything, Gabby?
Well, I think it's contextuality is right at the core of it, and taking a line out of the startup world, not what your great product is, but what problem are you actually solving? And I think when we talk about broadband, we have to remind ourselves the problem we're solving is getting people to use the broadband. Yes, we have to build the infrastructure. Yes, we have to get it connected. But if nobody actually connects to it to transform their lives, to get information, to do telehealth, to learn financial literacy, then we have completely failed at what we're doing. And so we have to, as we're putting together these local community groups, not just say this is what we think your problems are that you should address, but instead get all those right people sitting around the table to say these are the problems our community is facing. Most of those problems will not start with digital or be overtly digital, but can all have solutions that will come through that digital inclusion. And again, comes back to that's why it's so important to have those local community collaborations, because the local communities will know the real problems that they have to solve.
Thanks for the commentary on context, you all. Each one of you mentioned data, technical assistance, partnerships. I want to get you to dig a little deeper and talk about the role that has in advancing your programs, and I'll start with you, Gabby.
Well, I feel terrible looking right at Greg Conti and saying this, because he's heard me say this in every single broadband listening tour, but data. No one can figure out what they need or what they don't need in their community without that data. If it weren't for the maps that we were able to develop with Operation Connectivity using the data and information that came from Connected Nation, we would have never been able to go to school districts and say, here are the providers that will serve your different students and where they're located in your communities. And so often when I go into communities to help support them with how they are going to apply for funding that's going to come to solve the problems for their community, they want to start with the grant, and then they'll figure out how to use the money afterward. And we encourage them to start with the data, figure out where your need is, really contextualize your need using that data, and then write your grant based on that, and it will dramatically increase the chances that you're going to get funded. But more importantly, it will dramatically increase the chance that what you spend the money on is really going to reap the results that you're looking for in your community.
Thank you. Diane?
Yes, capacity, and to speak to data, I will say it is difficult for a small rural library to collect data in a meaningful way. And that's where I would love to see another collaboration, and that's with higher education. If we could get some researchers in on the front end when we're developing grants and developing programs, I think that would be very helpful. I'm working with the health science researchers at Georgia Tech now. You mentioned underutilization. Our telehealth room is underutilized, and I need to understand why, because I know the need is there. But it's beyond my capacity to really do research on it. So I have to bring in partners who can figure things out for me. So I think in our town, there is no newspaper, there is no TV station. So one of the issues we have when we're trying to work with people and offer them digital inclusion solutions is how do we get to them in the first place to even talk about it. And so we are part of a TSLAC grant for digital navigators, and libraries are great about borrowing ideas from other libraries. So I borrowed from Salt Lake City door hangers. Our digital navigators go door to door, literally hanging these on the door. And interestingly enough, free help, somehow that sounds like a scam initially to people, even from a library. So it takes our digital navigators being in person in front of people, that friendly face for people to really then trust and start to use the service. So I do think it's a long haul to get to some of this. Like you, I've started programs that like, oh, they'll knock down our doors, and it doesn't happen. So I'm glad I'm not the only one.
Right.
And Joe, what about you?
So fortunately for us, we've got a couple of champions for this effort in our community. So when it comes to data, as a nonprofit, I'm very busy, and for the other nonprofit directors in the room, you know what I'm talking about. We're busy trying to feed 5,000 people with 2 fish and 5 loaves. So our research efforts are going to be limited. So we lean on our what I call the oil tankers. We're a speedboat. So you've met Dr. Wynn Rosser with the TLO Temple Foundation. Through the foundation, they provide a ton of data and information and research that we tap into. DETCOG with Lunny Hunt. Actually, when we applied to become a digital navigator, I spoke with Vicki Thomas, who used to be on his team. She has since retired, and we were able to get connectivity data on the entire region. And for those of you who don't know how big Deep East Texas Council of Governments is, it's more than 10,000 square miles of territory. So for us, a little legacy institute in Lufkin, Texas, to get data on the entire region, that was the quickest way for us to do it. But it was at our fingertips because they had already been doing the work. So all I had to do was place a phone call. But then we also had our information from our clients. We partnered with the school district because some of our clients had students that were in the school district during COVID-19 that needed access. So thankfully, we had already asked the school district in 2019 for information on every household, or they couldn't give us names, but they gave us the number of households that did not have internet access from a school district perspective. We actually got them to add that to the registration for the students. So they gave us information when the time came, when COVID-19 hit in 2020. So that's how we obtained our information, and it was critical for us to go to our funders, as Gabby was stating earlier. It was critical for us to getting that funding.
You talk about data from the school district, so let's continue with that and ask about partnerships. Aside from the school district, what are some of the other partnerships you've put in place?
So we have a partnership with Angelina College, and this is something that has happened recently. So we will have office space on the college, one to provide financial literacy for the students and staff at the school, but they have identified us as a resource partner through our Life Tech program. Best Buy is no longer in our community. I'm not sure how you lose a Best Buy, but we lost Best Buy. So our largest computer supplier is gone. However, we're a computer refurbisher right there in Lufkin, Texas. So we're able to provide discounted hardware for our community. Well, over the last year or so, we've had people that are transient. We'd have people come into the police academy. We have a fire academy for people who want to be firemen. They're going to be in our community for a little while and then they're going to leave. So some people want to just lease a computer. Angelina College does not have that type of infrastructure to support a leasing program. So with our office space at the college, we'll be able to issue out leased computers and sell discounted computers to the students while we hopefully make them a client so that they improve their credit scores and things like that. So Angelina College, Lufkin ISD, and we also work with several employers to train their employees on digital literacy. Cybersecurity came up. We've got one through one of our largest HVAC companies. They work with a lot of computers, if all the thermostats and things like that. Well, one of their employees is in our training program for cybersecurity and other things. So those are really the types of partnerships that were established.
And you all also set yourself up as a registered apprenticeship program?
Yes. So we partner with the Department of Labor to become a registered apprenticeship program. So our IT training program is an apprenticeship program. So people will work for us or work for one of our employer partners for a period of time. And during that time, we try to get them 2 or 3 certifications that are industry recognized and are meaningful to them. Through that partnership, we get funding from the state. We work with our local workforce board, and that program has been extremely meaningful. Not only do we get funding to provide our students with computers and access to internet, but we can also pay for training, and it can help offset the cost of running some of the actual nonprofit type products that we offer at no charge to the community. So that is extremely important.
Diane, did you have any additional partnerships? I know you've shared a few of your telehealth partnerships. Are there any others you want to highlight?
Yes, so Senior Planet is a subdivision of OATS, Older Adult Technology Services. So we've recently been licensed by them to offer digital literacy for older adults. And so we do go into assisted living. We have classes at the library. And again, through a local foundation, they granted us $25,000 to hire 15 teenagers for an intergenerational digital navigation program. So we brought in the Health Science Center to do a simulation lab of what is it like to try to set up an email address if you have low vision or you have hearing disorders. And so I'm super proud that not only are we helping older adults with that digital navigation program, but we're developing job skills among these 15 teenagers, and their feedback has been, one was saying, I really appreciate my grandpa more, that he could haul hay like nobody's business, even though he doesn't hear well. So we have partnerships with our local COG, because we do a lot of aging in place. Our community is an older population, and what happens, it's a beautiful lake, Lake Texoma. People move from Dallas to buy a lake home, and then they retire at the lake, and then as they need more services, they have to move back to Dallas, because right now the services don't exist. But people tell us they want to stay in Pottsboro. So what can we do to help them age in place more successfully? And I think digital inclusion is a huge part of that. And so we work with the Area Agency on Aging to identify people who need help. But there's so many stories of things that I never knew, even though I've lived in this small town. I talked to, we've got a volunteer fire department, and she talked about the number of people who have dropped their landlines and now they only have cell phones, but they don't have a data package on their cell phone. The reason they keep them is they will still call 911. So the volunteer fire department gets these calls from people saying, I fell out of my bed, can you send somebody to help me get back in bed? And I heard an interesting story about how lack of landline affects shift workers. And they called it reliable unreliability. If your only device is a cell phone, no landline, and you're out of data, then your employer cannot call you to pick up an extra shift, or your doctor can't call you to talk about your children's diagnosis or what's going on. So we do partner with the volunteer fire department, as many organizations who will meet us and let us be at the table. We're all about it. I think, librarians sometimes it's quiet, introverted people have trouble advocating for the work we do. And so it's really important for me to be able to say, how do libraries get a seat at the table with all of you, so that we can all work together to make this happen.
Thank you, and over to you, Gabby.
Absolutely. Well, I mentioned a few partners already, but a couple I want to highlight that we haven't talked about. And the first is around workforce development. So as we work with each of these communities that are currently unconnected to develop pilots, one of the things that we have done is to bring a workforce development player to the table with us, Lit Communities, that has developed a curriculum for install techs. So as we're bringing routers and broadband into all of these homes, one of the greatest shortages that we envision is having enough technicians to be able to get out there to install them. What a great opportunity for communities to upskill and also create small businesses within their communities. So we've encouraged each community to take this workforce development, partner with community colleges or partner with a local institution of higher learning, and make that part of their collaborative application for funding the expansions that they want to do in their communities through that partnership. The second is partnering with OEMs, the manufacturers of the computers, but also the ISPs for security reasons. And I use a water example for this. It's not a great one, but it's the best one I can come up with, which is we make the water pipes and we put them into people's homes, but if what we're pushing through to those homes is bad water, we're going to make people sick. And we are bringing digital literacy and internet into homes that have not had it before at a time when cybersecurity and cyber risk is higher than we've ever seen before. And we are putting families, particularly from a financial literacy standpoint, we're teaching them how to get on and get their bank statements and do all sorts of things online they've never done before without the more sophisticated cyber training that they need to be truly safe. Therefore, it is incredibly important for us to work with our OEMs, our original equipment manufacturers, so the people who make our computers, to make sure that they are building in some of that safety into their equipment and that our ISPs are doing the same thing so that we're not putting these new digital citizens at risk the second they get onto the internet.
These are great examples from all three of you about partnership and really taking it to the next level. The last question I want to ask you all is, obviously, House Bill 5 passed, money is coming, there are solutions at hand. How do we maintain the urgency and the momentum of the work and not feel like, check, we're done now?
Well, we haven't built it yet. And a phrase I've been using a whole lot lately is the spigot will close. And when that spigot closes, the spigot to fund internet and infrastructure expansion isn't going to open up for a really long time. And so we need to act fast, and we need to act in a cohesive, planned, collaborative way so that the people who are unserved today don't continue to be unserved after that spigot closes. Because as I said, started out with, if this were easy, it would have been done already. And our tendency is to like to do the things that are the easiest because it takes less stress and challenge. But we need to start with the hardest because those are going to be the first ones that fall away when we finally get toward the end of when this money is running out. So if you are not running at breakneck speed by now, you better start.
Diane, did you want to add anything?
Yes, and I will sound like a librarian, and I will say storytelling, I think, is one of the answers to this. I think broadband and spectrum and megabits are very boring. And so when you talk about them, to me, a lot of people glaze over when we talk in our communities. But it's the stories of the real people, that mother of five, a 91-year-old woman who used our telehealth room, which meant she didn't have to be readmitted to the hospital during the height of COVID. It's those people and those stories, I think, that will keep the urgency alive.
And Joe, last word.
Very quickly, for us, first we had to embrace who we are in the grand scheme of things. We operate on a local level, not a theater level. So, like I said, we're the speedboats. So I pray and I hope that for the people who can handle the real solution, the infrastructure problem, until we get there, we have to control the narrative, meaning that for me, I have to violate a principle that my parents taught me: don't let your left hand know what your right hand is doing. So I really try to do a good job of not like talking a lot in the community about what I do, but the newspaper seems to be very interested in what we're doing. And for this effort, we need that. So we need to keep it at the forefront of everyone's minds. One of the things that I think about is, a few weeks ago, actually about a month ago, the Ukraine-Russia crisis was on the forefront of everybody's minds, but now it's the NBA playoffs, so that's kind of on the back burner. Well, this subject needs to be on the forefront of everybody's minds until the problem is solved. And so that means that for the people that are working on the ground, we have to make it be an issue until people realize, and to the government officials that are here, until you have the time to address these problems from an infrastructural standpoint, we have to do the work at the local level to make sure that the people don't forget that we see it every day, how much of a percentage of someone's salary is going towards internet. We see that. We see the lack of service. My wife is from Hemp Hill, Texas. For about 5 megabits per second, it's over $100 a month. That we see that and how it impacts their budgets. So we need to promote it, stomp our feet, spit, whatever we need to do to make sure that people don't forget the people that are suffering.
Thank you. I really appreciate your insights, all three of you. So please join me again in thanking the panel.